Healthcare is a highly regulated industry, and these regulations affect how clinical data may be used outside of clinical care. Understanding these regulations is vital to becoming a successful clinical data scientist. If you have seen a medical provider in the United States anytime since 1996, you almost certainly have heard the term HIPAA. HIPAA stands for the Health Insurance Portability and Accountability Act. One portion of HIPAA is the Privacy Rule, which sets out regulations on the use and disclosure of protected health information, or PHI. PHI is health information considered to be individually identifiable, things like demographic data and any data related to an individual's physical or mental health that could reasonably be used to identify them. Covered entities are those health plans, clearinghouses, and healthcare providers who electronically transmit any health information. The Privacy Rule defines and limits the circumstances around when PHI may be used or disclosed by covered entities. Clinical data that contains PHI is called identified data. Healthcare providers can use fully identified data for anything related to treatment, payment, and healthcare operations. Treatment is anything done to manage the care of a patient. Payment refers to receiving reimbursement for that care, and operations covers things like quality assessment and performance improvement. You'll often see these allowed uses of PHI abbreviated as TPO. The only exception to these allowed uses of PHI are psychotherapy notes, which have additional protections. Many clinical data scientists work for healthcare systems and perform their duties under TPO authorization doing quality improvement projects. Other uses of clinical data, like for research, typically require some removal of PHI. Partial removal of PHI is called a limited data set. Limited data sets require the signature of a data use agreement that requires the users receiving the data to agree to use the information only for the specified purpose, apply safeguards to protect the data, not attempt to re-identify the individuals, report any known breaches, and ensure that anyone else with access to the data follow these rules. A limited data set is one that has removed 16 direct identifiers like names, addresses, and social security numbers. Data that has all 16 direct identifiers, plus full zip code and dates removed or shortened, is considered de-identified data. The Privacy Rule does not limit how a covered entity shares de-identified data. De-identified data may be created under Safe Harbor, which is the removal of these 18 identifiers, or they may apply an expert determination of de-identification, in which an expert determines that the risk of re-identification of any individual patient is very small. Regardless of the level of identifiability of data, HIPAA applies a principle of minimum necessary use and disclosure. Covered entities must use only the minimum amount of data necessary for the given purpose and cannot share the entire record unless the amount of data is reasonably needed for the purpose. Overall, the HIPAA Privacy Rule has a fairly large impact on clinical data science. De-identified data, especially data that is de-identified by the Safe Harbor method, because of the restriction on dates to year only, can really limit the types of possible analyses. Also, data like text notes are not available under Safe Harbor because it is impossible to prove complete removal of the 18 HIPAA identifiers. Some systems have managed to retain clinical notes in de-identified data sets using the expert determination method of de-identification. The data set we use in this course has been de-identified in this manner. Many statistically de-identified data sets are able to keep full dates and simply shift these dates randomly in time. Typically, dates within a single record are shifted by the same amount, but that amount changes with each patient. For example, patient A may be shifted back by 6 months, while patient B is shifted forward 30 days. Because the date shifting isn't consistent across all records, it's impossible to study seasonal effects with this type of data. when data scientists are using fully identified data for TPO, the minimum necessary principle can create challenges. Data science is often about performing exploratory analyses, where we do not know in advance which data elements are necessary. Although these regulations can make it difficult to do clinical data science, it is important to recognize and respect the intention of these rules. Health data is considered by many patients to be intensely private information and has historically been used as a tool for discrimination by employers and insurance companies. As data scientists, it is our duty to ensure that clinical data are protected and used in a way that is respectful of the potential impact our work may have on the individuals whose data we use.